Hey guys, Dr. Scott Stiffey again. I just want to make a quick video today about like knee problems and knee pain. I was just working on a patient. He just left, and he'd already had knee surgery. He had a knee meniscus repaired back in March, so it's only been 6 or 7 months, and he's worse now than he was before he had the surgery. And that brings up an interesting point, which we can save that for another time. But, you know, there's a lot of research they've been saying for the last, really about almost 15, 20 years that they don't even think most knee meniscus surgeries are even needed. I mean, of course, there are always some, but they're saying the majority are not needed. 80, 90% are not needed because the current research states they take people that have a knee meniscus injury that have surgery, and they take a knee meniscus injury that didn't have surgery, and then they can look at them and compare them from 1 year, 3 years, 5 years. And most of the time, the patients that didn't have the surgery are better off than the ones that did. And so, you know, that's an interesting point. And like I said, we can talk about that later. But so he was just asking me, he's like, you know, I went through all the surgery, I did all this therapy afterwards, and, you know, I did like 3 times a week for 6 months and all this stuff. And I'm not any better. You know, he did MRIs and x-rays and the whole ball of wax. And he's worse now than he was before he had the surgery. And so, and he's just wondering how we can get that better. Well, we use a bunch of advanced specialized tools that, you know, honestly, a lot of people don't have or know what they are, or they really don't know how to use them if they do have them. But, and I've spent, you know, years. I've had knee injuries myself since I've been about 15, so I've studied knees forever. And so basically, you know, with the knee joint, there's a lot of different things that can happen. And you know what? Sometimes some injuries, you do need surgery. And I've referred people for surgery many times. But we now even have a lot of orthopedic surgeons and other medical doctors refer patients to us first. And maybe we can prevent a lot of those patients from having surgery, and we've done that many times. Basically, we had a patient just a few months ago. He had the I think they usually call it the terrible triad. He had the torn meniscus, tore ACL, and tore MCL, and he didn't really want surgery. He was done playing sports, all that stuff. Basically, he just has his normal job now, and he's doing phenomenal. You know, we did some treatment on him. He went through a treatment protocol. And I think it's actually been a year, and we followed up with him to see how he was doing. He's doing great. He's even back to playing softball and things like that. So that's awesome. Anyway, so there's a lot of different injuries that can occur, and maybe I'll make some more videos talking about the different types of injuries. But what we use, these different types of technologies, I do like some advanced muscle procedures around the joint. It really reduces pain fast, increases your range of motion. People tell me their knee feels so much easier to move. It feels loose. It was like really stiff and tight. It feels loose. They can move it easier, and they feel a lot more stable. So it seems to do that very fast. And then we do, you know, some other different types of treatments that helps your body heal much faster than if you didn't do them. And we have some different supplements, and we have a whole different protocol that we use, but we've been getting phenomenal results for a very long time. So anyway, if you have any questions, just drop a comment below or give us a call, and I'll be glad